Welcome to the Immune Edit. I'm Dr. Doug Jones. If your immune system feels like the enemy, or you're just tired of not feeling like yourself, this space is for you. Hi, everyone. This is Doug Jones here with my fellow colleagues. Do you want to introduce yourselves, Farah and or Dr. Khan and Dr. Chacko?
That's right. That's Dr. Khan to you, Dr. Jones.
I will respect not my elders, but even my youngers.
Y'all are my elders. I'm so excited to be here and chat with you guys. Look at Tom's face. I called him an elder.
I want to ask you how old you are, but I'm pretty sure I'm not allowed to. Let me leave that
I
alone.
know.
He's actually taping.
I know. This is going to be a
We're
good
already off
conversation.
track. We're already off track.
I know. I'm an allergist, mostly seeing pediatric patients in Columbus, Ohio, in the academic setting.
Great.
And I am Tom Chacko. I am also an allergist in the Atlanta area, seeing peds and adults, seeing everything.
Awesome. So today what we're going to do is we're going to have a 3-part series on everything food allergies. And many of you have probably seen the three of us put some segments together. What we've done is taken some collections of questions that we had in some of the previous sections that we weren't able to answer. We've put those together into a 3-part series. So part 1 is going to be through the patient's journey from that reaction all the way through diagnosis. We have some pertinent questions with that we're going to answer. Part 2 is going to be then transitioning into treatment options. And then the third part of this 3-part series is going to be parents and families. How are we dealing with that emotional load that goes on with food allergies? So it'll be 3 sections, 3 segments. So I'm going to start off with a question to you two. And first of all, it's going to be something that irritates me. I'm just going to start out of the gates.
Great.
There is one
I'm
thing.
getting excited. What's he going to say, man? A lot of things irritate him.
There are a lot of things that irritate me.
I've known him for a bit, man.
It's true.
But there is one thing that really irritates me when I get on social media and I start seeing influencers talk about this topic of hidden food allergies. See, for a minute I thought that was your middle finger, Farah.
No, it's not.
Anyway, the hidden food allergies, and the reason I have my reasons why that irritates me, but it kind of leads into this onslaught of patients that come in looking for their hidden food allergies, or they have this whole huge spectrum of symptoms and they all want large panels of tests. And so the first question I have with that lead in of the hidden food allergies and all the things is, when do you guys test for food allergy? Like when somebody has a symptom, when there's a symptom out there, like when is it appropriate to test and what is appropriate to test?
Fair, you want it first?
You want me to give the diplomatic answer, and then Tom's going to come in and be like, well, actually.
You might not. You're not wrong. You're not wrong.
This is the truth according to the Book of Tom.
So the history guides everything, right? And a good allergist, I'm gonna say that again. A good allergist is gonna take the time, even if it takes just a few minutes, to kind of parse through some stuff and figure out where are these symptoms coming from. Food allergy reactions are not hidden, and they are not like it's not like you're just living with a peanut allergy and you don't know it. Like you know it. You know it, okay? You know it. It's anytime you've been exposed to a peanut butter cookie or a peanut butter sandwich, like food allergy reactions are not subtle. And when just this week, I had like definitely 4 or 5 patients that I can think of off the top of my head where the parents were like, how do we know that the nasal congestion isn't a hidden food allergy? And I was like, uh-oh, like it's time to stop scrolling a little bit, guys.
So and I'd agree with what Farah said. It's not a subtle thing. I'm like, you should know it. Like, I should look at you and be like, what's up? Like, you look like Hitch. You look like Nutty Professor, or something. You should be able to show me some picture of something that's going on. I like objective data. Show me a picture. You literally, or hives or something. So if you're like,
Mhm.
I feel fatigue, I feel whatever, I'm like, you may have some food intolerance or sensitivity. That's totally different. But in
Yeah.
regards to food allergy, what our tests tell you about, it's not subtle. You know it.
Mhm.
So
Right.
that's my take home on that.
So what's really happening with those influencers that why do they even put that out there? Why do you
Money, money, money,
Oh, I
money.
like that. I like the singing. I
well,
didn't, can we do more though?
we have a bonus section
I
from
know. I like that actually. I like it.
It's money. Money. Like, let's be real, guys. It's money, right? And they
I
take
know. I like
advantage
that.
of patients who have symptoms that need to be addressed, right? And our healthcare
right.
system is not set up to address those thoroughly and in details. And so people walk out of their 10-minute or 15-minute PCP appointment or their allergy appointment and they're like, what the heck? Like, nothing got addressed. I'm still dealing with these symptoms. And so where do people turn? Online. Like,
Mm.
everybody's online looking for health and medical information. Now, is everybody able to figure out what is credible and what is not? Unfortunately, no. And that's where the wellness and health influencers have filled a vacuum, unfortunately.
And where are they making money from this? I'm gonna lead you into the next questions, but where are they making money on this?
I actually don't know. I only follow
Tests.
you guys. So I only
Tests.
follow you.
Supplements,
First of
workshops,
all,
like yeah,
tests,
Yeah.
yeah,
IgG tests that
yes,
they, home test kits, saliva tests, like a bunch of
yeah,
invalidated tests that they're going to be selling, first of all.
Yeah.
yep. Hair
And
testing,
next,
like send me a sample of your hair and I'll tell you what you're allergic to. Yes.
I
mhm,
just got 2 today, this morning, on that come in with a panel of IgG testing, and I feel I already know they're gonna be mad at my response because
Yeah.
they spent
Yeah.
a lot of money, and I'm like,
Yeah.
and I look at it and pretend like
pretend to look
oh
at it.
okay, but yeah, they're gonna be mad if you don't give it some credibility. They spent 200, 400, $500. They're not gonna like that answer, and then I'm
Yeah.
like. The validity behind this is not the greatest. I kind of like sugarcoat my answer because I don't want to
Mhm.
insult anyone, you know. But at the end, we know that's not helpful. At the end, we know
Right.
that.
Yeah.
Yeah. Real evidence shows it doesn't correlate with symptoms at all. But why do those tests continue to exist? Farah, take the chorus away.
Money,
No,
money, money, money.
I like Farrah's energy, man. I love this energy.
I mean, let's cut to the chase, right? Like people are making hundreds and thousands of dollars off of this stuff. Like
Yeah.
it's not a small market. You're not making pennies. Like if like this is insane. And I want to know, why don't people actually sue these companies that market these food sensitivity tests? Like why aren't they getting sued up the bejesus? Like why?
I don't know. I don't
I don't
know.
know either.
Um,
I don't think legally you can because you can't tell people you're doing something wrong. You can't legally say they are wrong. So I don't think legally you could sue them. You just say it's not evidence based. There's nothing, but people swear by it.
we're not giving legal advice today, by the way.
Yeah.
No, we're
No.
not lawyer. We could
We're
be.
not
Why?
we're not
Look,
giving legal or medical
no, look who
advice.
our current HHS secretary is. If he can be a doctor, I can be a lawyer. Get out of here.
Have
There you
Farrah's
go.
not holding back. We know people's. This is not like DC political,
No,
but
but don't the food sensitivity tests claim that they will tell you what you are having an intolerance
Sensitive
to,
to.
right? That
Yeah,
that is unequivocally false.
yes. They'll I should pull one if somebody starts rambling for a minute, I can pull up what's exactly on their websites. But what they'll claim is kind of it will detect that you're creating an immune response against this food. But what
but
they don't tell you is that immune response doesn't mean it's bad.
no. And,
Like it may mean tolerance.
and the crazy
Yes, which
part
is
is,
what IgG
yeah,
is.
like we
Right.
track that as a good thing.
Yes.
We actually use
Yeah.
that number to say, oh, you tolerate peanuts well. Let's check if
Yeah.
the IgG goes up or milk
Right.
IgG goes up. So these are actually in our studies are published. The IgG is considered a good thing that's tracked. You know?
Yeah.
Yes.
It's
So
telling me
they're
your immune system's working.
Yeah.
right. So it underscores that vast amount of misinformation
Hmm.
that people who are Desperate, meaning they're desperate because they have real symptoms.
Mm-hmm.
They have real issues. They are struggling primarily with bloating, stomach pains, food intolerances, all across the board. And what are they? And they're going to be sold. I always say the one thing sells, the one thing, or the one thing sells, the one thing scales, but the one thing often fails. And what do I mean by that? The one thing that sells is that test that
Yeah.
somebody can believe in or have confidence in. And then they can scale that test. Why? Because that test isn't under anyone's purview or license. And the people selling the test aren't real doctors. Or maybe if they are, they're doing it in a way that, they can scale this to a cash model. Why? Because they don't have to prove medical necessity like those of us in real medicine have to prove every single day. But why does it often fail? Because it is not the answer. They're selling that misinformation. They're selling hope to patients, and they are so desperate because they feel so bad and they're so sick, and they just want the answers. And so many times, and you guys have probably heard this, they'll come in and say, look, just tell me what I need to avoid and I'll avoid it. And so just do the whole panel. I just want to know what that is, right? But we have to take kind of the more nuanced answer, the more kind of oftentimes complicated answer, to help them understand, yes, your symptoms are valid. Yes, what you're going through is valid. But if you keep knocking down the allergy door, you're never going to be let in, because that's not the right door. It's like the dating game with the mystery doors, number 1, 2, and 3. It's like, which one are
Oh
you
no.
picking?
Oh no, this is a terrible analogy.
So, behind door number 1 is misinformation. Behind door number 2, maybe some actual legitimate testing, which we can talk about now. What is behind door number 2? Like the one you want to actually engage with, or there are some legitimate tests, right? So, as we know, there's skin testing and blood tests. Do you guys want to just comment really briefly on maybe why those are validated tests, when we should order those, but also maybe some of the limitations to those tests?
And Doug, I did want to make a comment though on the money part on the IG, because we run a practice here in Atlanta, a busy allergy practice, right? But I remember like 3, 4, 5 years ago, Groupon called me saying, "Hey, we could do this IgG testing. We'll charge them 400. You get 200. We get 200, and let's do a Groupon." And I was like. I was so confused, but so if this test is done on Groupon, that's a problem. So just on the money behind the IgG testing, I something to think about.
You got to sing it. You got to sing it, Tom.
Oh, I only rap, man.
You gotta rap. You gotta rap.
I only rap or hip hop and R&B. I can't sing. Sorry. All right, next question.
IgG testing isn't the way to get your bay.
Fucking try. Wait, did this get edited?
Okay, but what is the testing good for? So Doug we've alluded to this before, but the IgE testing, the food specific IgE testing, is looking at that allergy antibody. The skin test and the lab test are pretty much measuring the same thing, just different ways to look at it. But they're also only good for one thing, which is that classic allergic reaction, like the stuff that people hear about in the news. Like I gave my kid peanut and the lips broke out, and or the lips swelled up, broke out in hives, vomiting. We ended up in the ER, EpiPen. That's the only thing that it tells me. It doesn't tell me anything else. So it does have limitations, including false positives, which I'll let Tom chime in here.
So there are false positives, meaning it could be positive, especially the blood work. If you do it in an eczema patient and they have a high IgE, often a lot of time the IgE is super high to everything. So that's why you don't want to just do screening testing, because they're like, oh, my child has this, and I do all this blood work and eczema, and I do all the blood work, and everything is going to be positive. And that's, we probably see that on a daily, if not weekly basis. And then there's harm to that, because then now you have this positive testing and you may avoid a food where now it's that window where you want to introduce it. So there's false negatives, maybe, but more so positive tests that 50, maybe 80% false positives. So you have to be careful. History plus testing then give you the diagnosis.
Yeah, any of those numbers, I always say you have to have it, not the number by itself, but always in the context of the person and that history in time. Um, so, how do you utilize these tests in your clinical practice? So we have the tests. There are some validated tests. We just went over kind of some of this, what they're looking for, but also the limitation. So how are you utilizing these tests in your practice?
So we trend over time, right? Then
Mhm.
it's helpful. Not necessarily the skin test, but the lab test can be really helpful. You get a baseline marker and then you repeat every 6 months if it's a younger baby, 6 to 9 months, or every year or something like that. And you do want to see what the overall trend is. But I think this also kind of depends on like the allergist and the office that they're at. And like I think a good allergist is going to look beyond the numbers. So I recently had a patient who has an egg white of almost 100, and he had been doing great on the egg ladder. I know both of you guys are not huge fans of it, but this is the thing that worked for the family. And he ended up coming in for an unbaked egg challenge, and he put down like an entire scrambled egg with like no issues at all and an egg level of almost 100. And I was like, this is crazy, right? Like, but if I hadn't paid attention to what he had been doing and what he had been tolerating, like I would have never challenged. I would have just kept that kid egg allergic. So trending over time can be helpful, but it's not like a hard and fast rule for me.
So wait, so Farah, the IgE to egg was over 100, but history was meh, and you challenged and did fine. I'm asking more so than saying.
So he had I think like hives with the initial scrambled egg exposure when like less than 1 year of age, like maybe 9 months or something like that. And then we just had him avoid for a little bit. And then eventually we did a baked egg challenge. He also had like other things we were working through,
Mhm.
like other adverse food reactions and eczema and just a bunch of other stuff. So by the time we got back around to the egg, what we were doing in the meantime at home was working on the egg ladder.
Mhm.
So he passed the baked egg challenge, and then they were like, "Okay, great. Like, can we do some more stuff?" And so then I was like, "Great, let's go up on the ladder and do less heated for him." So then I repeated the labs because he had been on the pancakes and waffles for, God, I don't know, like a few months, several months, I can't remember. And it was still almost 100, the egg
Okay.
white,
Okay.
even though his like total IgE had dropped a little bit. And I was like, I think he's ready. And the parents were ready to challenge. And I was like, okay, come on in. And he did great. He did so good.
That's all. So I would say this. So this is going out to the rest of the world, right? So this is I would say that's excellent. Number one. Number two,
Yeah.
most allergists would not challenge that.
I
And that's
know. I
okay.
know.
And that's okay. That's good. That's the benefit of you being in a good food allergy institution that can do higher risk challenges.
Yeah.
That's an advantage that you have. Like even me, I do a lot of challenges, as you all know, but I would be nervous about doing a 2-year-old with an IgE of 80 or 90 to egg
Yeah.
and scrambled egg. So I think that I want the public to know that not every allergist is the same, not everyone does the same, and not everyone has the same capabilities. So
Hmm.
I think that's awesome that you did it, but I would say most would not. But but now you just cleared that kid's egg allergy, so it's a win
Yeah.
for you. It's a win. I just
Yeah, like one less year or even
yeah.
one less month of not having to avoid egg, like for me, it was worth it for the family. And again, this is probably the exception, right? Like most people walking around with an egg level of greater than 100 are probably not going to be able to chow
That's
down on
fair.
hard boiled eggs and scrambled eggs. But I think there are more and more patients where you're like, oh my God, like these kids are really atopic, right? They
Mhm.
have like really bad eczema and all of their food numbers look terribly
Yeah.
high. And then how do you tease it out? Right? You're not going to know. Unfortunately, there is no commercially available, really good 100% fail proof testing that's going to be like, this kid's numbers are falsely elevated. Give them chickpeas or give them
Yeah.
peanut or give them cashew or whatever. Although,
Uh,
never mind. But yeah.
on a tangent of that, I'm sending my first bat on Monday. So I'll let
Oh,
you
good.
know. I'm doing my
Woo!
it's a military guy who's peanuts
Yeah.
probably like 30. And I've talked with a tool. I've got about 2 or 3 military people that I'm doing bats on. And so
So
you could sorry, Doug.
just
I
for
know
the
this
audience,
might be
what
off
he's
topic.
talking about,
Yeah.
what he's talking about is a test called basophil activation test. And I used to run a lab that, you know, did those tests routinely. And so it's kind of a different level. The way I describe that test for just for the audience is it's like doing a food challenge in a test tube.
Mhm.
uh, you know, to where you're introducing different concentrations of food basically to that person's blood, to their cells. and seeing at what point that cell opens up and degranulates, and you know, so it's not a perfect test, but it does give us some extra, nice information. It's only available in a few centers across the United States. Hopefully at some point it becomes more widely available. So
Yeah.
awesome.
For more to go, I got like 3 or 4 that I'm waiting on. Predominantly military people.
Yeah.
Predominantly like 3 or 4.
Interesting.
So I'll
Yeah.
I'll keep you posted. That'll be my next fast one. I'll present what I got
Yeah, I
at the
love
fast
that.
meeting, actually.
There you go.
Yes,
So
people should
really,
come. Providers should come if they're listening to this. Come to the FAST meeting if you're looking at food allergy treatment options. It's a great conference.
It is.
they can, yeah. And if you have questions on it, go to fastoit.org, fastoit.org. It's a non. I had to make sure my spelling was okay.
You can spell.
OIT, you gotta spell it.
Go to fastoit.org. It's a nonprofit organization that is dedicated to best practices and diagnostics of food allergy and treatment. And we all get together every year and have a great time. So just to quickly wrap up this first segment, just a couple of quick hitter questions, and then we'll wrap up this part 1 on the diagnostics. Is all the time online I see or hear of parents comparing one child's IgE numbers to somebody else's numbers. And they'll say, well, my kid is more severe because mine has a peanut IgE of 67. And,
Yeah. You use it on purpose?
and
That's
then
pretty good.
your child only has a peanut IgE number of 30. Or worse, they may compare a peanut IgE with an egg IgE. What's the problem with those? Real quick, brief.
Every food is different. Every patient is different. An almond of 5 or a cashew of 2 are totally different things. And the patients, ask your allergist. Unfortunately, you don't know.
Yeah.
Ask your
Yeah.
allergist and run it by them, because there's no way a non-allergist could help differentiate. You need to talk to a specialist.
Yeah. And the number one rule is that the numbers never help predict severity of reactions or how much food it's going to take to cause a reaction, right? So it's not an apples to apples comparison.
Yeah.
And just to kind of wrap that up, if there's, not just parents, but if there's pediatricians listening or mid-levels listening, and you're ordering some of these tests, just be aware that a specific IgE to peanut you cannot translate that, or how we interpret that, to say a specific IgE to egg, or walnut, or almond, or cashew.
Or cashew.
Even though the test is the same test, even though they put those ridiculous scales on the side, and even though the numbers are presented the same, how it's interpreted on every single food in every single patient is different. And there's nuance to it. And there is far more to that puzzle and that picture than just that number. So don't treat them all the same. Don't look at it the same. And, if you're ordering those tests, or even parents, as you're listening and you're looking at some of these tests, do not compare, and get to an allergist that has experience, that knows the nuance, that understands the proper ordering of these tests and the interpretation of the tests. Okay. Don't compare. So that's going to wrap up part 1. And we hope you all will tune in to our next episode, part 2, where we're going to dive deep into treatment options. Thank you so much again for tuning in. We'll see you next time on The Immune Edit. This show is separate from my clinical practice at Global Allergy Immune Network. This show represents my opinions and my guests' opinions. Neither myself nor the show endorses the views or statements of my guests. This show is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. This show is provided with the understanding that it does not constitute medical or other professional advice or services. If you're looking for help in your journey, please seek out a qualified medical practitioner. It's important to have someone in your corner who is a trained and licensed healthcare practitioner who can help you make changes, especially when it comes to your health.